Hi, this is Peggy Earle with ETS Wound Care. I'm the clinical specialist. We're going to show you today about how to change the dressing and care for a pressure ulcer that's on the ischium. First of all, we're going to clean that ulcer. I like to use this nice little foam sponge. This is very easy to acquire if you're in a hospital setting, as these are used quite frequently in the hospital. And then just blot the excessive moisture. If I were cleaning a row wound, I guess, I would probably also clean this outer peri-wound edge to ensure we removed any excessive peri-wound drainage or debris. Okay, today we're going to use a 2x2, but again, you can see how fluffy this product is. There's a lot of layers here. And so with this wound itself, it's very small. I don't need this much product. I would suggest to you that I could use a 1x1 on this small ulcer. And I didn't even get a full 1x1 out of that. So, and just in case this wound, there's probably going to be sufficient moisture here, but just in case, let's think that this may be shallow enough that there's not a lot of moisture in that wound bed, and that the patient might find that a little uncomfortable. So to alleviate any concern for discomfort or having a wound that's not moist enough, I'm actually just going to drop a few drops of normal saline into that wound bed just to make sure that patient has sufficient moisture and is that's a comfortable dressing for him. Also, we do have a little dead space there, so we could probably think about that as well. And I'm going to have a dry topper, and then let's just do another dry topper as well. I'm going to secure this with an occlusive dressing. That again will ensure that we, if that wound is too dry, that we will have sufficient moisture balance in there by occluding the gauze. This is a beautiful transparent film that is actually silicone with a very low profile, and I have found this to be an awesome way to secure a dressing, especially on pressure ulcers, because these folks wiggle around in bed a lot, and this will have a low profile so that when they do move around, you can see that I have very secure edges here. I'm rubbing that with some pretty good force, and you can see that that friction does not roll the edge of that dressing up. That's very important when you're taking care of a patient who's bedbound or wheelchair bound, whichever may be the case. And so there you go. That's the end of that. Thank you.